If you are waking up with legs that feel heavy, or if you look down and see that the skin on your feet has a pale, waxy quality, you need to pay very close attention. Poor circulation is not merely an inconvenience or a sign of getting older. It is a physiological warning light. Statistically, peripheral artery disease affects over 8.5 million people in the United States alone, and millions more suffer from subclinical circulation issues that go undiagnosed until a major event occurs. The coldness you feel in your extremities, the tingling sensations, and the sluggish recovery from minor injuries are all indicators that the vascular highway system in your body is failing to deliver oxygen and nutrients where they are needed most. This is a progressive issue, meaning if you ignore it today, the biological machinery will only degrade further tomorrow. Now, you might be expecting me to prescribe a pharmaceutical intervention or a rigorous exercise routine, but the solution I am going to discuss today is actually found in the vitamin aisle, yet it is almost certainly not the vitamins you are currently taking. There is a specific potent triad of vitamins that, when used correctly, acts as powerful vascular medicine. But if you get the form or the dosage wrong, you are wasting your time. My name is Richard Coleman. I have spent over 30 years in geriatric medicine helping seniors reclaim their health, and today we are going to have a very serious conversation about the biochemistry of your blood vessels. I am not here to offer you a quick fix or a magic pill, but rather to explain the physiological mechanisms that are currently failing in your body and how we can restart them. Before we dive into the science, I want to ask you to do something for me. Please scroll down and leave a comment telling me which city and country you are watching from. My team and I read through these comments, and it is genuinely encouraging to see a global community of older adults taking proactive steps to manage their health. If you find this information valuable, please like the video, share it with someone who might be struggling with mobility issues, and subscribe if you are new here. When patients come to my clinic complaining of poor circulation, they often bring a bag full of supplements they have been taking, usually generic multivitamins or proprietary circulation blends that promise the world but deliver absolutely nothing. The harsh reality of the supplement industry is that it is flooded with products that are chemically ineffective. Most multivitamins contain what we call dusting amounts of nutrients, just enough to claim it's on the label, but far below the therapeutic threshold required to actually alter human physiology. If you are taking a standard multivitamin hoping it will unclog your arteries or warm up your feet, you are essentially flushing your money down the drain. The vascular system is a complex network of pressure and flow, and to influence it, you cannot use a shotgun approach. You need a sniper approach. Based on decades of medical observation and biochemical fact, there are really only 3 specific compounds that have the potency to physically open constricted blood vessels and restore flow to your legs. The first compound we must discuss addresses the 2 fundamental problems of poor circulation: the narrowing of the pipes and the thickness of the fluid flowing through them. Imagine trying to push thick sludge through a drinking straw. That is essentially what is happening in your legs when you have high viscosity blood and vasoconstriction. To solve this, we need a cleanup crew, and that comes in the form of vitamin B3. However, this is where most people make a critical error. They go to the store and buy any bottle labeled niacin or B3, often ending up with a form that is biologically inert for our specific purpose. We are looking for a very specific reaction that only occurs with high-dose, flushing niacin, also known scientifically as nicotinic acid. This distinction is absolutely critical because many people accidentally buy no-flush niacin or inositol hexanicotinate, thinking they are getting the same benefits without the uncomfortable side effects. While the no-flush version has its uses for cholesterol management over very long periods, For the specific purpose of forcefully dilating the capillaries in your lower extremities, it is virtually useless. We need the flush. The flush is not a side effect, it is the mechanism of action. It is a physiological phenomenon where the niacin causes a rapid release of prostaglandins, which are lipid compounds that have diverse hormone-like effects. These prostaglandins signal the smooth muscles lining your artery walls to relax immediately. When these muscles relax, the vessel diameter expands, a process called vasodilation. It effectively turns that narrow, clogged country road into a wide, 4-lane highway. When you take the correct form of flushing niacin, you will experience a sensation of warmth, redness, and perhaps itching across your face, neck, and chest. This usually lasts for about 15 to 30 minutes. I tell my patients not to fear this reaction. Instead, view it as visible, tangible proof that the compound is working. If your face is flushing, it means your capillaries are opening, and that same opening process is happening deep within the vascular beds of your legs, forcing blood into areas that have been starved of oxygen. Beyond just widening the vessels, niacin creates a favorable shift in the lipid profile of your blood. It helps reduce the production of very low-density lipoproteins and triglycerides, effectively making your blood less sticky. When we reduce the viscosity of the blood and simultaneously widen the vessel, we dramatically reduce the resistance your heart has to pump against. This allows oxygen-rich blood to finally reach those cold toes and heavy calves. However, because this is a potent therapeutic intervention, we must treat it with the respect due to a medication. You never start at the maximum dose. I always advise starting with a low dose of 250 milligrams, taken once daily with a substantial meal. Food acts as a buffer, making the absorption smoother and the flush more manageable. If, after 2 weeks, your body tolerates this well, you can increase to 500 milligrams daily. This 500 milligram mark is often the sweet spot for circulation boosting in many adults. A small clinical tip I offer is that if the flush is too intense, taking a non-aspirin anti-inflammatory about 30 minutes before your dose can mitigate the sensation without blocking the vascular benefit. But consistency helps the body adapt. Usually within a few weeks, the flushing sensation becomes much milder as your body regulates its prostaglandin response. I must issue a strong medical caution here. Niacin at these therapeutic levels affects the liver's processing pathways. If you have a history of liver disease, gout, active peptic ulcers, or if you are currently on medication for diabetes, high blood pressure, or cholesterol statins, you absolutely must consult your primary care physician before starting this protocol. We need to ensure your liver enzymes remain stable. Once we have established a wider pathway for your blood using niacin, we face the next major hurdle in the aging body, which is the physical structure of the artery itself. You see, you can force a pipe open with niacin, but if the pipe itself is brittle and hard, it cannot expand. This brings us to the structural integrity of your vascular system. Widening the blood vessels with niacin is an excellent first step, but it solves only half the equation. You can try to widen a pipe all you want, but if the material of that pipe has turned from flexible rubber into brittle concrete, it will not expand, or worse, it will crack under pressure. This brings us to the second critical compound in our protocol, which I call the flexibility fixer. As we age, a pathological process called vascular calcification occurs. This is often described in layman's terms as hardening of the arteries, but medically we refer to it as arteriosclerosis. Essentially, calcium, which should be in your bones and teeth, starts to deposit itself into the soft tissues of your arterial walls. This makes the vessels stiff, unresponsive, and narrow, drastically impeding blood flow to the legs and increasing the workload on the heart. This is why many seniors have high blood pressure. The system has lost its elasticity. To reverse or prevent this stiffening, we need vitamin K2. It is imperative that you understand the difference between vitamin K1 and vitamin K2, as they are often confused. Vitamin K1, found in leafy greens like spinach and kale, is primarily responsible for the coagulation cascade. It helps your blood clot so you don't bleed to death from a cut. It is essential for survival, but it does very little for removing calcium from your arteries. Vitamin K2, on the other hand, is the navigator. Its primary role is to activate a specific protein called matrix Gley protein, or MGP. This protein is one of the most powerful inhibitors of soft tissue calcification known to science. Think of MGP as a microscopic vacuum cleaner that circulates through your vascular system. When vitamin K2 activates MGP, it actively seeks out calcium that is erroneously deposited in the soft tissues of your blood vessels and physically removes it. But it doesn't just remove it, it acts as a traffic controller, redirecting that calcium back into the skeletal system where it strengthens your bones. This solves the calcium paradox we often see in geriatrics, where a patient has calcified, hard arteries but weak osteoporotic bones. For the purpose of leg circulation, generic vitamin K2 is not enough. We need a specific subtype called MK7, or menaquinone 7. The reason we prefer MK7 over other forms like MK4 is strictly down to pharmacokinetics. MK7 has a much longer half-life in the body. While other forms are cleared rapidly, often within a few hours, MK7 remains active in your bloodstream for days, providing a constant, steady activation of those calcium-removing proteins. This continuous coverage is vital because calcification is a 24/7 process. The therapeutic dosage we are looking for is between 100 micrograms and 300 micrograms per day. Please note the unit carefully: micrograms, not milligrams. It is a tiny amount, but it is biologically potent. You can find K2 naturally in fermented foods, particularly a Japanese dish called natto, which is fermented soybeans. However, natto has a very strong, ammonia-like smell and a slimy texture that many of my Western patients find difficult to consume daily. Therefore, supplementation is often the most reliable route to ensure you are hitting that therapeutic window without dietary struggle. Because vitamin K2 is fat-soluble, you cannot take it on an empty stomach with just water and expect it to work. It requires dietary fat for absorption. Taking it with your morning eggs, some avocado, or even a fish oil supplement ensures that the vitamin crosses the intestinal barrier and enters your system effectively. If you take it with black coffee and toast, you are likely absorbing very little of it. We need to maximize the bioavailability to ensure those matrix Gley proteins are fully activated and scrubbing your arteries clean. There is, however, a critical safety warning regarding vitamin K2 that I cannot stress enough. Because it is part of the vitamin K family, it plays a role in the coagulation cascade. If you are currently taking blood-thinning medications, specifically vitamin K antagonists like warfarin or Coumadin, you must not add this supplement to your regimen without direct supervision from your prescribing doctor. Vitamin K can interfere with the efficacy of these drugs, potentially altering your INR levels and changing your clotting risk. Modern blood thinners operate differently, but the rule of thumb in medicine is always to check interactions first. If you are not on blood thinners, K2 is generally very safe and is a crucial nutrient that is almost entirely absent from the modern Western diet. So consider the progress we have made so far in this protocol. We have niacin acting as the force that pushes the vessel open, and we have vitamin K2 working over the long term to ensure the vessel walls remain soft and pliable enough to respond to that push. We have addressed the mechanics of the pipe and the material of the pipe, but there is a third component required to maintain this system minute by minute. We need a signal that keeps the vessel in a relaxed state throughout the day. The body needs a command center to tell the arteries, stay open. This brings us to a vitamin that everyone thinks they know, but almost everyone utilizes incorrectly when it comes to vascular health. We need to talk about the opening signal, which is vitamin C. This is not about preventing a cold. This is about the structural integrity of your endothelium. Most people associate vitamin C strictly with the immune system or fighting off the common cold. While it is excellent for immunity, its role in vascular biology is arguably more profound and certainly more critical for your leg circulation. The inner lining of your blood vessels is called the endothelium. This single layer of cells is responsible for producing a gas called nitric oxide. Nitric oxide is the body's master relaxer. When it is released, it signals the arterial muscles to let go, widening the vessel immediately and allowing blood to flow freely. However, nitric oxide is an incredibly unstable molecule. It degrades within seconds of being produced. This is where vitamin C becomes non-negotiable. Vitamin C performs two vital functions in this specific context. First, it increases the synthesis of nitric oxide synthase, the enzyme that creates the gas. Second, and perhaps more importantly, it functions as a potent antioxidant that creates a chemical environment preserving the nitric oxide, preventing it from being destroyed by oxidative stress before it can do its job. It effectively stabilizes the open signal for your arteries. Without adequate vitamin C, your endothelium cannot maintain dilation and the vessels clamp down, restricting flow to your legs. To achieve the vascular effects we are discussing, the dosage of vitamin C must be significantly higher than the recommended daily allowance, which is barely enough to prevent scurvy. We are aiming for a therapeutic dose of 1,000 milligrams to 2,000 milligrams daily. At these higher levels, standard ascorbic acid, the cheap white powder you find in most supplements, can be quite harsh on the digestive tract, potentially causing acidity, heartburn, or loose stools. To avoid this, I recommend using a buffered vitamin C, which is chemically combined with minerals like magnesium or calcium to neutralize the pH, or even better, a liposomal vitamin C. Liposomal technology encapsulates the vitamin in tiny fat bubbles, which allows it to bypass the harsh environment of the stomach and absorb directly into the cells, offering superior bioavailability without the gastric distress. This ensures that the high dose actually reaches your bloodstream, where it can support your endothelium. However, the secret to making vitamin C work for your circulation isn't just the form or the dose, it is the timing. This is a detail that many general practitioners overlook. You must take your vitamin C in the morning or early afternoon. I strongly advise against taking high doses of vitamin C in the evening or before bed. Vitamin C plays a role in the production of neurotransmitters like norepinephrine and can have a mild stimulating effect on the central nervous system. In my practice, sleep hygiene is paramount for older adults, and taking a stimulant, even a mild natural one, late in the day can disrupt your sleep architecture. Furthermore, your vascular system follows a circadian rhythm. The demand for blood flow is highest during the day when you are upright, walking, and active. By taking 1,000 milligrams with breakfast and, if needed, another 1,000 milligrams with lunch, you are front-loading your system with nitric oxide support exactly when your legs need it the most to combat gravity and activity. When you combine these three elements, niacin, vitamin K2, MK7, and vitamin C, you are creating a synergistic triad. Niacin forcefully expands the vessel and thins the blood. Vitamin K2 clears the calcium deposits to restore the vessel's elasticity. Vitamin C fuels the endothelial lining to keep the relaxation signal firing. It is a comprehensive strategy that addresses structure, flow, and signaling simultaneously. This is why circulation blends often fail. They might have one of these ingredients, but rarely all three in the correct forms and dosages. Now, I want to manage your expectations realistically. In a world of instant gratification, we want a pill that fixes everything overnight. That is not how biology works, especially when we are trying to reverse damage that may have accumulated over decades of lifestyle choices and aging. When you start this protocol, your initial response within the first week will likely be the niacin flush. You will feel that warmth, which is a positive sign. Over the midterm, spanning weeks 2 through 6, the consistent supply of nitric oxide from the vitamin C and the vasodilation from the niacin should result in your legs feeling lighter. You may notice that you can walk slightly further before fatigue sets in, or that your feet are not as ice cold when you get into bed. The tingling sensations may begin to subside. The long-term benefits, however, require patience. The decalcification process driven by vitamin K2 is slow and steady. It takes roughly 3 months or more of consistent supplementation to begin seeing significant changes in arterial stiffness. This is why I ask my patients to commit to a 90-day protocol. You cannot skip days. Biological repair requires a constant supply of raw materials. Make it a ritual. Niacin and vitamin K2 with your main meal to buffer the flush and aid fat absorption, and vitamin C with breakfast and lunch to power your day. This consistency is the key to retraining your vascular system. In conclusion, having poor circulation in your legs is not a destiny you have to accept as part of aging. It is a mechanical and chemical problem with a mechanical and chemical solution. By moving away from generic low-dose multivitamins and focusing on therapeutic doses of these 3 specific powerhouses, you are giving your body the tools it needs to repair itself. You are taking active control of your health span, not just your lifespan. Remember, always consult your own doctor before starting high-dose supplements, especially if you are on medication, to ensure this plan is safe for your specific medical history. Your health is an investment, and taking care of your vascular system is the best way to ensure you stay active and mobile well into your golden years. Thank you for your time, and I look forward to reading your comments below.